Joining me now, Dr. Natalie Azar, rheumatologist at the NYU Langone Medical Center. Always good to see you, but what are the risk factors and symptoms for whooping cough? Why so many cases now?
Yeah, so, basically, Christine, what we are seeing is that, this public sentiment about vaccines has definitely fostered some immunization hesitancy over the last number of years. And, going way back to the beginning of the pandemic, Chris, we saw between March of 2020 and September of 2020 a significant decline in vaccinations. Before vaccines, the whooping cough vaccines were routinely recommended for infants, there were about 10,000 deaths every year in the United States. But since the vaccine was routinely recommended, there have been less than 20 deaths every year. And the kids who are most vulnerable are under 3 months of age. The series, the vaccine, the initial vaccine series for kids, it does sound like it's a lot, and all parents know this. It's 2 months, 4 months, 6 months, then 15 to 8 months, and then again between the ages of 4 and 6. So it's a 5-shot series to be fully protected, and then a booster again as an adolescent for youngsters to be fully protected.
But we also know, as you just said, the lives that it has saved. We've also been talking a lot, as you know, about the bird flu. Now that virus has been detected in raw cat food, and it's raising some concerns for pet owners. A house cat in Oregon died. What can people do for their pets and, of course, themselves to avoid this deadly virus?
Yeah, so pets are vulnerable just like humans are. And the culprit here is definitely going to be raw or undercooked meat. Any exposure or certainly eating a sick or infected dead bird. And unpasteurized milk. So a lot of those things, obviously hold true for adults as well as pets. But these recommendations to avoid what I just mentioned, particularly these raw foods, these pet foods that are raw, even if they're frozen, is coming from, veterinarians in this country who are making this recommendation for pet owners. I would say that just like with adults, Chris, keep your eyes and ears open and listen for these recalls. Definitely, you need to be aware of what's in your freezer and what you are feeding to your pets to be aware of any of this and to, get rid of any of these products if you hear that there's been a recall.
I flew over the holidays, including coming home just last night, and I did notice that virtually no one had a mask on at the airport. Very different, obviously, than what we all got very used to. Look, as people travel across the country for the holidays, what are best practices for travelers to keep in mind? What viruses should people be aware of that are out there? What can we do about not getting sick for the holidays?
Yeah, well, unfortunately, even though I would still recommend a seasonal flu shot and a COVID shot if you are, eligible for one and you haven't received one. The winter is still long. It might be a little bit late to protect yourself for the holidays, as it takes about 2 weeks, to build up antibodies after you've gotten the vaccines, Chris. But, between flu, COVID, RSV, whooping cough here in the U.S. and norovirus, which is a gastrointestinal or the most common cause for foodborne illness in this country, good practices remain the same as we've always said. Hand washing, avoid touching your face if you can. And if you are one of those vulnerable people, a well-fitting N95 or KN95 mask while traveling definitely still makes sense, Chris.
Dr. Natalie Azar, happy holidays and thank you for the good advice. Much appreciated.